All right, well, I think we're going to get started. We still have some more people joining us, but I want to be respectful of everybody's time. So welcome, everyone. My name is Maureen Scallon-Failer, and I'm president of the Chamber of Dakota County Regional Chamber of Commerce, and I welcome you to the Dakota County Critical Issues Forum. This is a new program that we just started during the COVID-19 pandemic, and what we do is we like to bring issues of importance of critical nature to our membership. The Dakota County Regional Chamber of Commerce is the influential voice that champions the promotion and improvement of the business environment, cultivating vibrant regional and local communities. And it is great to have all of you with us here this morning for what I think will be one of our more interesting programs and very informative. And our topic is we are all in it together, COVID-19 updates for business. And I was just talking to our speakers, our panelists before we went live about just what has transpired over the last 72 hours. And as I sat and watched the news over the course of the last few days, to see the trucks, the FedEx and UPS trucks being loaded with the vaccine, to be moved out, to be distributed, really took my breath away and put chills up my spine. Never in the history have our country been able to turn around and produce a vaccine as quickly as we have for COVID-19. And I know all of our panelists have been very involved and very engaged in discussions behind the scenes as the vaccine is here in the state of Minnesota and how the vaccine will be distributed and administered. And I'm just very, very thankful for all the work from everybody who has made that happen. Our guest this morning that we have, and I'm real proud of these individuals, is Dan Huff, Assistant Commissioner with the Minnesota Department of Health, Gina, A to Z, and Gina will chime in when she speaks about that, Public Health Deputy Director of Dakota County Public Health, and Sharon Lamberton, Deputy Vice President of the Pharmaceutical Research and Manufacturers Association of America. And Sharon, I believe you're down in Washington, D.C., if I'm not mistaken. I would like to acknowledge our sponsors for today's program. Without sponsors such as these, we would not be able to provide these types of programs that I think are so important for our members during this time. I'd like to acknowledge Spire Credit Union. They are a nonprofit financial cooperative that was founded in 1934. They have branches throughout Dakota County, Egan, and St. Paul. CenturyLink is a telecommunications company that offers high-speed internet, fiber, voice, phone, and TV services for residential and small businesses. SKB Environmental is in the recycling business, and SKB Recycling is Minnesota's longtime leader in innovative processing, recycling, and total waste management solutions. Think Bank, people and money. For most of us, it's a complicated relationship, but they are in several locations throughout Dakota County and over in Hennepin County. And finally, I'd like to recognize Twin City Orthopedics. And Twin Cities Orthopedics is committed to providing world-class service to everyone. These companies have been very supportive of the chamber, and their commitment and involvement are evident of the value in being involved with the Dakota County Regional Chamber of Commerce. So we are going to get this started, and we are going to take it from the 100,000-foot level and start bringing it down. And I am pleased to turn it over to Dan Huff with the Minnesota Department of Health. Dan, the floor is yours.
Well, thank you, and good morning, everyone. It's nice to talk with folks in Dakota County. It's a little bit of a homecoming. I'm from North Carolina originally, and when I moved to Minnesota, I was a science teacher, and decided I wanted to try a different career and moved to the Dakota County Extension Office down in Farmington, where I worked for a number of years, um, supporting efforts in Dakota County. And so nice to be with you all this morning. I have a fond place in my heart for all things Dakota County. I just want to acknowledge that, public health in Minnesota is a partnership. It is a partnership between local public health and the state. And Dakota County is served so well by one of the premier county public health departments. So it's nice to be with my colleague Gina here today. I am going to give, as Maureen said, just starting at the high level, I'm going to give some of the background of where we are right now with the pandemic. As you know, Governor Walz 3 weeks ago issued Executive Order 2099. This is referred to as the dial back that we are currently in. And we anticipate that he will be announcing our next steps, our next phases this week. So I wanted to just frame it first about how is COVID spread. So COVID is the disease caused by the SARS-CoV-2 virus, and it is a respiratory virus, or rather spread through the respiratory system. So it's about how much am I breathing out, and then how much are you breathing in. Mike Osterholm calls it when we're swapping air with someone. So anytime that we are with other people outside of our pod, we are potentially exposing ourselves to someone who is infected and swapping air with that person. Anytime we're indoors or in areas of poor ventilation, that increases the risk. And anytime that we are closer than 6 feet or for periods of 15 minutes or longer, we increase that risk. We can also infect ourselves by touching surfaces and then rubbing our eyes or nose or mouth and transferring the disease. That's why hand hygiene is so important. Masking really helps to bring in and contain all that moisture and droplets that we are always spewing out of our mouth, whether we're talking, laughing, singing, breathing hard because of exercise, or just breathing normally. We're always exhaling water droplets, and the virus floats around on those droplets. So that's why masking is so important as well. And anyone, you can transmit the disease, that is, you're infectious, even if you don't have symptoms. In fact, a couple days prior, before getting symptoms, you will can spread the disease. So about 1 out of 5 or 20% of the people who are infectious have no symptoms. And especially for younger people and healthier people, that's one of the things that has made this such a nasty disease, and one that has spread so incredibly fast around the globe and keeps popping up. Once we think we kind of have it licked, it rears its head again. COVID is a serious disease. For some people, it may be very mild, but for others, it can be quite severe. It attacks what are called ACE2 receptors, and these are found throughout the body. They are found mostly in the lungs, and that's why the virus attacks the lungs primarily. But you do have these receptors in your brain and your nervous system. You have them in your blood vessels. That's why we've seen an increase in stroke, heart attacks, kidney disease because of the blood vessels there, and this a strange multi-inflammatory disease in some children. Then we have what we call the long haulers. For whatever reason, some people it takes a very long time to recover. COVID fog or brain fog, its impact on the central nervous system. So, and it seems to be kind of random. We haven't figured out why it impacts some people more severely than others when people are young and healthy. We do know that the older we get, or if we have other comorbidities or other underlying health issues, that does increase our risk for more severe disease and death. Here's a snapshot of our numbers. These are the cases that we have seen in the state. We did a really good job. Now, remember back in May when we were really worried and panicking, and this was an alarming time, when we were at 5,000 cases per week. But we were able to, with our the shutdown order, stay-at-home order brought us down. Through our mitigation measures we practiced this summer, we were able to keep a lid on things. As soon as we went back to school and people started going inside because it got cooler, we started getting COVID fatigue and some of our practices began to break down. We saw this increase and we hit exponential growth to where we were up close to over 45,000 cases a week. Quite tremendous increase in growth. With the measures implemented by Governor Walz, we're now seeing, and just the participation of people in Minnesota, a dramatic decline now. So we're getting hopefully away from that really scary numbers that we've been in. Again, with case positivity, that is how many people getting tested and how many of those are positive, we are bouncing around some. We've seen a real decline, but now we're starting to go up again. That's something we continue to watch. COVID, sometimes people associate it with the metro. The metro is actually not the most severely impacted by the disease, not by a long shot. As you can see, the darker the blue is the more severe, the more cases per 100,000 or 10,000 people. So you can see that Western Minnesota, and especially that sort of south central area, has been most heavily impacted currently. Now, this is a really interesting chart as we look at how did we get to where we are now with this incredibly high rate. This is how many cases per 100,000 people. You can see we kind of bounced around 10 cases per 100,000 people. And then on September 17th, we went up above 15 cases per 100,000. At that point, we started acceleration. That is, we started our case numbers increasing. Within 2 weeks, within 3 weeks, we were up to 20 cases per 100,000. And then it only took 2 more weeks to where we got to 30 cases per 100,000 and hit exponential growth. And we went from 30 up to 120 in just a few weeks. So we were up to 120 cases per 100,000 people when we had been able to hold it at 10. So we see this somewhere between 10 and 15 cases per 100,000 is the tipping point. And once you start to accelerate, unless you put the brakes on hard, it's very difficult to turn back around. But you can see we have put the brakes on hard and we are turning, but we're not out of the woods yet. In fact, we are still at about 80 cases per 100,000, which is alarmingly high and some of the highest in the world. Here just gives you an idea of sort of how long it takes cases to go when you start to hit exponential. This first blue band, that's how long it took us to get our first 100,000 cases, 207 days. It took us only 41 days to get our next 100,000 and only 16 days, just over 2 weeks to get our next 100,000. But you can see that we're actually doing fairly well right now in maintaining this sort of burgundy color. We're definitely slowing down our rate. Still way too fast compared to where we were earlier, but slower than we just were. Let's see, why is this not working? There we go. Same thing with our death rate. We did see a fairly steep increase in deaths the first part of the pandemic. It was brand new. It hit some of our most vulnerable populations, and the medical community had not come up with many of the techniques they have now. Back then, we were at about a 2.5% death rate. Now we're down to about a 1.1% death rate. Still scary for disease. 1 out of every 100 people that get it will die, but better than we were. Hospitalization, we've heard a lot about hospitalization, which has been absolutely critical. And there's 2 factors that have impacted hospitalization and the ability for our critical care to serve our needs. One is just how many people enter the hospital. And you can see again, when you have exponential growth of cases, you're going to have exponential growth of people entering the hospital, and then exponential growth of people dying as well. We are seeing that decline now. However, it is still very high and still stretching our capacity. Again, ICU admissions, very, very similar. Patients that hit the ICU, as you know, take a tremendous amount of healthcare resources and a tremendous amount of people to help keep them alive. Once people reach ICU, their survivability rate plummets. But here's the double-edged whammy that we have faced and why hospital capacity has been such a concern for us. Just like other people in the state, healthcare workers get sick. If there's more COVID disease in the state, that means more healthcare workers are getting sick as well, or are contacts of people getting sick. So while we had beds filling up with COVID patients, we had nurses and doctors who were out of work because they were either infected or had contact with an infected individual. So we have a lack of staffed beds. It was a double whammy, and that's what happens when we hit a pandemic. We have not faced this type of critical shortage in our lifetime for healthcare. And what it means is if I slip on the ice, if I have a heart attack, if I break an arm, or something happens to a member of my family, they will not receive the same amount of care that they would have a month ago because we have filled to capacity with COVID and at the same time limited and decreased the capacity of our healthcare workers. This is incredibly scary for all of us. And finally, we have seen, unfortunately, an increase in our death rate as well, marrying the exponential growth we saw in cases. Wanted to just go over what's paused right now. You probably know, I'm sure some of you are in these businesses, and it's an incredibly hard financial hit for these businesses. I ask that you support them as much as you can, especially doing takeout during this period of time. But I wanted to just frame why we, the dial back, targeted these businesses and not other areas. What we did is we really looked at what are those settings that favor the disease spread. Anywhere you have multiple households mixing, where you have a lack of social distancing, and I would say random mixing as opposed to, you have a work pod and you have a home pod, but rather where are those areas that pods just are all hidgety-pidgety mixed up, where you might have a lack of social distancing, where you're indoors, where you're speaking or singing or laughing like a bar scene, or breathing hard as in a gym, where it's difficulty to mask, say you're eating or drinking, you can't mask when you eat or drink, and when people are together for longer than 15 minutes. Sometimes I'm asked, why is the Mall of America open? Well, retail was left open. Our look at the scientific literature, our own outbreak data, and then looking at the setting, people go into retail, they shop, and then they leave. They don't really stand around and visit with the same people, swapping air for that 15 minutes or more time period. There are obviously, the Mall of America can be a congregation areas, but as you know, it's sometimes very difficult to slice and dice well, what's open and what's not. People criticized us for having Walmart open at the beginning of the pandemic where the local shoe store was closed. We do know that people have to get critical supplies, groceries. Walmart is a grocery store as well as selling shoes. So as you know, there's a lot of just regulatory difficulty sometimes. But right now, this gives you an idea of why we have chosen the dial back to really focus on those areas where we see that mixing. Our own outbreak data support that, and then the scientific literature supports it as well. That's some of our outbreak data. I won't go into that. But our conclusions are, when people gather in any setting and when our disease spread is as high as it is in Minnesota right now, any interaction outside of our pod is dangerous and risky for swapping air with someone who's infected. And that's all. Really appreciate all the work everyone is doing. These are the best ways that we can continue to slow the spread of the disease. Thank you.
Thank you, Dan. And I forgot to do a little quick background of you. So just know that Dan, being the Assistant Commissioner of the Minnesota Department of Health, has over 25 years of experience in public and private nonprofit sectors of education, environmental health, and public health. And you have been at the Minnesota Department of Health since 2019 as the Assistant Commissioner of Health Protection. So thank you so much for all your hard work and what you do for us, the residents and the businesses in the state of Minnesota. Now I'm going to turn it over to Gina, and as she's getting ready to share her screen, Gina is the Public Health Deputy Director for Dakota County Public Health. Gina is a public health nurse and received her master's in community health nursing from the University of Colorado. And Gina has worked for the Dakota County Public Health for the last 32 years in variety of roles. So I'm going to turn it over to Gina, and now we're going to bring it down a little deeper. Gina, A to Z, it's yours.
Great, thank you, Maureen, and thanks, Dan. Yeah, it's Gina Adasowicz. We wanted to just make sure I could pronounce the name. So welcome, everybody, and good morning. And I just wanted to kind of say what Dan said about what a great partnership we have with the Minnesota Department of Health, and we certainly couldn't do this work if we didn't have such a great partnership here in Minnesota. So as Maureen said, I'm going to be covering a little bit of Dakota County data, taking it down a little bit, and then also sharing a little bit of our public health roles and responsibilities, so you can kind of get a flavor of what we're doing in Dakota County to address this pandemic. So some of this information Dan shared, but as you can see, we are just a little shy of doing 5 million tests in Minnesota, which is really good. We're at about 40,000 or more tests per day. We need to keep testing so that we can keep seeing where this COVID is at. In Minnesota, the confirmed cases you can see, and then in the metro area, and then our cases in Dakota County. And as Dan said, they are trending down just a tad bit, which is good. The death rate as well, we do see a slight uptick in the long-term care cases, but we're keeping an eye on that as well, and hopefully we'll start seeing that to decrease as well. This also Dan showed as far as our hospital admissions, and again, this is important to keep an eye on this, because if we have a lot of increased pressure on the hospital and their staff, then it is problematic for other people that are trying or have to be hospitalized. We know that our hospitalizations have tripled since October, so that big increase, you can kind of see that trend going up in all of the data slides that we'll be showing. This is just another way to look at it. Again, about 5.4% of the beds are available in ICU, and then about 3% of the beds are available on non-ICU beds. So again, we have to keep a good eye on this to make sure that we keep this open for more than just COVID patients. This is our percent positivity in the metro area. You can see in Dakota County, we're at about 12.4% positivity for the time period of November 22nd through the 28th. This is a slight increase from the last period, which was about 11.8%. So we're still not as high, not as low, kind of in the middle. And we're looking at Minnesota is hovering about 12 to 13% with a peak of 15.4% in the past. So keep an eye on this, because this has fluctuated greatly in the last couple months. We look at the 14-day case rate. This is an interesting piece of data, because this is what the schools are looking at to determine if they will go to distant learning or hybrid. And so this is, again, data from November 15th to the 28th. We're always a little bit behind in our data, because we wait for it to come in before we can report it. But as you can see in Dakota County, our case rate, our 14-day case rate was 141.51. Again, not the highest, not the lowest. But to put this in perspective, in October, I went back and our numbers were in the 20s. And so you can just see the huge jump that we've seen in October and November. And in order to be back in-person learning, our numbers would have to be below 10. So that just gives you a perspective of where we're at and how high we are with our 14-day case rate. This is a dashboard that we have on our Dakota County website that I wanted to share with you. And again, this is something that you are able to access. Go on our Dakota County website and click the COVID link, and this will take you right to this page. It gives you a lot of great data. It's updated daily. It will look at, cases, hospitalization. It can delineate by cities and all kinds of demographics as well as testing. So feel free to go out there and take a look at that. If you need more information or data that's Dakota County specific, and if you have specific questions about our data, you can contact us and we can certainly help you understand what is out there. So transitioning to kind of what we're currently doing in our department to address the pandemic, we've had our Dakota County hotline open since the get-go. The information is on the screen there. We're available to answer questions of all sorts, and if we don't know the answer, we'll certainly find it for you. Also, the Minnesota Department of Health has a great hotline. I've used it myself, and again, it's just a place to start if you don't know who to contact, because you can be that first entry place of asking about any kinds of questions you might have, and then we would be able to contact or get you connected with the right people to help answer those questions. The other operations that we're doing, and this is a heavy lift that the Minnesota Department of Health is doing, of course, is case investigation and contact tracing. This is where anytime there's a positive case, we're required to contact that person, talk to them about their isolation or quarantine guidelines. And like I say, Minnesota Department of Health has the heavy load with this, and apparently what I heard yesterday is they're contacting or doing about 3,500 to 38 calls a day to these folks and are caught up. So that says a lot about the incredible work that's being done. Our public health department is doing this to help out the Minnesota Department of Health, and been doing that since probably late August to September. What this slide is showing is that in the last couple of weeks, the CDC has changed their quarantine guidelines to make it a little bit less restrictive, maybe a little bit better, easier to adhere to some of the quarantine guidelines. So what this is saying is that still, if you have been in contact with a positive person, the best is to still quarantine for those 14 days. That's the top part. However, if you have been in contact with a positive person, you don't live with that person, then a 10-day quarantine is advisable. And then the last one is if you are in contact with a positive person, you don't live with that person, and you get a negative COVID test, 7 days is advisable. So these are new guidelines, a little bit complicated. And so again, if you have specific questions for your employers, you can call either one of the hotlines and they can certainly walk you through what this means for your business. The other area that we're working on that we're required to do is what's called essential services. So as people are tested positive, some of them may be living by themselves or may be living in a home situation where they can't quarantine or isolate. So it is our responsibility at the local public health role to make sure that these people have the correct housing. So we've had to put some people in hotels. We've also had to provide some of these families with food if they're unable to get it themselves. We certainly rely on their friends and family first, but we've had a number of situations where we need to deliver food, medications, masks, and household cleaning supplies and things like that to the family, and with the whole intent that they stay in their home and they're not out in the community spreading the disease. So this is something that we do, and it's a very busy area. We've had over 600 and some calls and deliveries to essential services for people that can't get it themselves. And then of course, we're very proud that we have 3 testing facilities in Dakota County. 2 of them are MDH sponsored. One is in Burnsville in the Pier 1 location on 42. The other one is Inver Grove Heights Armory. And they've been up and running for a good month or so. They do the saliva test. It's a no barriers testing. Appointments are required. There are a few walk-in options if needed. And then also we partner with Dakota Child and Family Clinic, which is a local clinic on Cliff and Highway 13. And they've been doing the nasal swab tests with us since August. So we have a couple options to provide for community residents, and those are on our website as well as the Minnesota.gov website under testing locations. And then of course, hopefully you all know that if you're unable to go to these sites, you can order an at-home saliva kit at no charge that will be delivered in the mail to you, and then you can use it to do the saliva test kit at home, which is very easy to do and a nice way for people that can't get out in the community and get their testing done. This is just a fun picture on the left, our Dakota Child and Family Partnership when they did made their 5,000 test mark, which was kind of the end of, I think, October. They now are up over 7,500 tests. And then the picture on the right is from the Inver Grove Heights Armory, just showing the testing location of how they're spread out for social distancing. So the Dakota Child and Family Clinic, we have collaborated with them since August, kind of we're calling it the first phase, which was August through November. This just shows that we held 44 clinics. They were a drive-through clinic. We tested over 6,500 people. The average positivity rate during this time was about 8.4%. I'll draw your attention to October to November, where you can see the huge increase of positivity rate as we started to climb and on that trajectory that Dan talked about. This data then is the data from the Minnesota Department of Health sponsored sites, the Burnsville site at Pier 1 and Inver Grove Heights. They're conducting a lot of tests every day. They can do up to 1,000 tests every day. Percent positivity, again, pretty darn high in October, or this was actually November. But I tell you, the feedback, and I went through the testing myself just to see how it was done. It's very well run. It's great people helping you understand what you have to do the saliva test. And the turnaround is certainly 24 to 48 hours. And when I did it, I got my results back in 36 hours with a nice email explaining, what needed to happen next. So if you have folks that need to be tested, these can be found on our website and highly recommended. This is just Dakota County positivity rate. This again is found on our dashboard, but I thought I would include it. It's been about 12.4%. And again, you can kind of see that trajectory go up from October to November. And then more information where the testing sites are located. I won't get into a lot of this detail. Again, it's on our website. But the Pier 1 and the Inver Grove Heights are saliva, where you go into a building, and then the Dakota Child and Family is a drive up. Still, you can drive up to their location and they will come out and actually do the nasal swab while you sit in your car. So a nice option for the upcoming winter. And all of them would prefer appointments just to keep coordinated. The Dakota Child and Family one will be running through mid-March. And we are hearing that the Burnsville and Inver Grove Heights will probably be through the end of January. So in addition to all that, we have assigned our public health staff to work directly with cities, schools, work sites, clinics, long-term care, and faith-based organizations. So I know that there are work site connections and to answer any questions that might come up from your perspective. So again, if you don't know who that is, or you need, you have specific questions about, as an employer, what to do with your employees, you can contact us through our hotline, or you can contact me directly and we can get you connected. But it is a way to really bring that information down to the local level and to work directly with these folks and answer any questions, connect them with resources. And then we have another real big effort to connect with the Black and Latino communities in Dakota County. We know that they have been disproportionately impacted by COVID. So we're working with them to provide them resources, to make sure that we get social media out there and to connect with their communities as well. And then finally, just to transition a little bit into COVID vaccine before I hand it over to Sharon. We know the vaccine is here. And so the big next step is to get this vaccine into a vaccination, to get people vaccinated. So just kind of briefly, just give a high level overview. We know that right now we're looking at 2 vaccines, Pfizer, which is on the left there, and Moderna, which hopefully will be approved this week and will head our way shortly, is on the right. They both require 2 doses. That ultra cold, which you've heard about, is the Pfizer vaccine, and that right now is being shipped to hospitals around even Minnesota. Very effective, and the Moderna one is, again, can be frozen, very effective as well, and that's will be the one that will be probably coming to public health here shortly. I wanted just to share with you a couple of the phases that we are looking at and actually implementing as we speak. These phases are decided by the Advisory Committee on Immunization Practices, or you might have heard ACIP. So they are giving the direction on and the recommendations who gets the first vaccine. They will give that to Minnesota Department of Health, and then we take our direction from the Minnesota Department of Health. So as you can see, phase 1 on the left there, we are really starting to ramp up and plan for this. It has been further delineated into 1A, B, and C. So healthcare workers, long-term care are kind of that, and EMS are for kind of that first cut. followed by the essential workers, and then followed by adults 65 years older and underlying conditions. So we're working fast and furious on that, and we know that probably the first vaccinations will be shortly, and then we'll go into March, and then followed by phase 2, which is more of a population-based or large clinic, community clinics that we'll be hosting in Dakota County in larger buildings that we can have the community residents attend. And then also phase 3, I didn't put a date on that because we really don't know quite yet, but I've heard Dr. Mike Osterholm from the is expecting to be kind of later 2021. And this can all change, but this is kind of what we know right now. This is just another timeline that I thought would be interesting. Last week, of course, we had the FDA gave the emergency use authorization to Pfizer. ACIP guidance was issued on December 14th, and lo and behold, we've got the Pfizer vaccine coming to Minnesota. This week, the FDA will meet for the Moderna, as we're hoping that will pass. And then we will see some of the Moderna vaccine coming to public health the week of the 28th. And hopefully be able to give shots in people's arms right after the first of the year from public health to the community. These are just a couple fun pictures. The one on the left, if any of you were around during H1N1, that's what it looked like when we gave vaccination clinics in large buildings. This, of course, will be different because we need to socially distance, but we are looking at our Northern Service Center, our Western Service Center, and maybe a school to hold these large community clinics. The bus on the right is not ours, but we were able to purchase a trailer, a smaller trailer than this, that will be able to get into hard to reach populations and give vaccinations out in the community. And then the middle picture on the bottom there is just an indication of what the vaccination clinic might look like with social distancing. And of course, once we get through spring and a little bit warmer weather, the drive-through is something we haven't talked about yet, but it might be an option that we might be able to host to get more vaccinations during early spring and summer. So moving forward, vaccine is coming, but it's here. More of it is coming, of course, and safety is a top priority. We will really keep an eye on making sure that the vaccine is committed, we're committed to get an equitable distribution. We will, follow the ACIP guidelines and what MDH is telling us. That information, as we figure out more and more who's getting the vaccine, when and where, will be on social media and on our website, and certainly, out in the open, so we can coordinate and communicate with our populations. And then we'll continue to have the testing facilities so we can control the spread of the pandemic. And of course, what we're asking of everybody is, in addition to all this, is that to continue to socially distance, wear masks, wash our hands. Those are behavior changes that we can all do. And then finally, to get the vaccine once you're able to get the vaccine. So I also wanted just to add that if you have questions or need more information, there's a wealth of information out there. Highly recommend these 3 areas for their websites: the Center for Disease Control and Prevention, Minnesota Department of Health, and Dakota County. And if you search COVID on any of them, you can get a lot of information, and certainly use us as resources to help understand if you have questions. So with that, that's all I have, and I will hand it back over to Maureen. So thank you.
Thank you so much, Gina. Very, very interesting and informative. So Gina and Dan, if you could periodically, there has been a couple of questions put in the chat, and just to maximize time, if you could look at some of those questions. I know Dan answered one, to just help so we can get some of these questions answered. So now we're going to be hearing from our last speaker, Sharon Lamberton, Deputy Vice President of the Pharmaceutical Research and Manufacturers Association of America, a trade association of 35 biopharmaceutical companies based in Washington, D.C. And Sharon provides policy analysis support, clinical expertise, and a strategy for multiple industry-related issues, such as cost and value of medicines, adherence, access to insulin, prescription drug abuse, and clinical trials. So Sharon, thank you so much for joining us, and the floor is yours.
Thank you so much, Maureen. It's a pleasure to be here with you, and what a great presentation from both Gina and Dan. I really learned a lot and do these pretty much every day, and I love those presentations. Very informative and talented folks. And thank you, Linda Carroll Shern, my colleague, and Peter Fjellstad, who also works with Minnesota, and I are just really appreciative of your time, because we want to deliver what has been a great week of good news in the midst of terrible news as far as how many deaths. We have over 301,000 deaths here in the U.S. from COVID, reaching cases of over 16.6 million. In Minnesota, we have 328,000 cases, 4,521. We couldn't have a better time than this week when we saw the first doses delivered and into the United States. And as Gina said, we hope to see Moderna's vaccine approved on Thursday, and that's extremely exciting. I saw a news article this morning showing that Minnesota is going to have 47,000 doses with the first round shipment, and another 100,000 for Moderna's if and when approved. So really good news. And I want to start by the next slide just talks a little bit about what did we do as an industry. For you all that don't know pharma, that we have on the first slide, if you would go back just to the first slide, that's basically our biopharma companies are about 34 different member pharmaceutical companies. And we have a variety of ways. And just one more back, sorry, on the second slide there. Perfect. The 5 ways that we started looking at how do we attack this virus when we started seeing it appear and emerge in December of, just a few months ago. We mobilized very quickly, and I do believe it's because of the strong research and development that we had, strong policies in the state of Minnesota and throughout the country that protects innovation and fights for innovation. And if we had not had that, there's no way we could have mobilized as quickly as we did and had what happened this week happen, because we couldn't have had a vaccine that came to market as quickly as it did. And it was because of the hard work of our researchers, our development of our scientists, just incredible collaboration. And some of those ways we looked at working when we saw the emergence of the pandemic of COVID was we looked and saw what was on the shelves that we could currently use. What were certain medicines that we could use that could be pulled into treatments or vaccines. We had all hands on deck. Scientists from every facet of our companies were pulled into COVID. About half of our 34 member companies have treatments or vaccines in development underway in the pipeline, so that's pretty astronomical. We also shared clinical trial data real time. And you might say, Sharon, didn't you always do that? But we really had not shared to the degree that we did this past December and January, where we saw the emergence of the virus. We were able to decode it in just 4 months, as opposed to the SARS virus that took 20 months to decode. And we were sharing with the Chinese Medicine Association, the European Medications Association, folks that we didn't traditionally quickly share data with. We were collaborating because this was all hands on deck worldwide as we saw it attack other countries before coming to the US, and of course has hit us probably in the worst way. And certainly couldn't collaborate more quickly with our own agencies, which was great to see. The FDA, the WHO, the BARDA, HHS, CDC, everybody's working around the clock, really, especially as we move through the approval phase right now, and the emergency use authorization, which I'll talk about in a moment. And then, of course, making sure that it would be affordable. Whatever treatments and vaccines that were developed, would they be affordable for patients? And as Dr. Fauci said back in February, he had never seen the biopharma companies price gouge or price unaffordably, and he didn't expect it to do so. And sure enough, we, on the very next slide, talk about issuing a pledge. 9 of our CEOs immediately put forth a pledge saying, once we do have a vaccine and treatment, we pledge that our medications from our company will be priced in an affordable way. We also worked with the supply chain stakeholders, because not only pharma, we make the medications, we manufacture them, but we don't distribute them. So once it's approved or authorized in this case, getting it out to the people in Minnesota is very different partners. Now, that's not to say we throw our hands up and say we're done. We stand in collaboration and we work with those stakeholders to make sure that it's streamlined. But It's distributors, it's the pharmacies, it's the health plans, it's the public health associations, everybody that needs to come together. So we issued some guiding principles on the bottom right-hand side that really collaborated and really talked about how we were going to get it out and streamline it once it's approved or authorized. The next slide just goes into a little bit about our clinical trial diversity. And as referenced earlier by Gina, we have seen COVID disproportionately impact the communities of color. And there's a number of reasons for that, but we needed to make sure that our clinical trials that were underway for treatments and vaccines appropriately reflected that patient population. So that meant we needed to make sure, as we were actively recruiting these patients very quickly, mind you, to get the 30,000 plus participants in, we wanted to make sure that they were diverse, not just in race, but in gender and medical profile, in age, all these different things that were so important to make sure that these medications that were being developed would be appropriate for all patient populations, but especially those that were of the diverse populations. And we're now working in 4 main areas. We released our first principles on clinical trial diversity ever in mid-November. Happy to share that with you all also offline, but it focused on how do we educate the communities of color, because they do have a longstanding distrust of the medical community and pharmaceutical community. So what can we do to build that trust and reduce barriers for clinical trial access? Next slide. So after we and one more, after we had actually released those trials, we said, we backed off and said, how many clinical trials do we have worldwide for therapies, for vaccines? And I'm so happy to say that as of today, and this number is changing weekly, 1,737 clinical trials are underway in the world. And you might say, how many are in Minnesota? 34. So 34 of those 1,737 clinical trials are in the state of Minnesota, again, pointing to the strong, solid research and development that you all have, the incredible work of healthcare providers and premier medical facilities in Minnesota that are conducting these clinical trials. So thank you for those efforts. The next slide talks to you a little bit about where are those vaccine trials occurring. And again, it's really exciting to see it's all over the United States, specifically 29 of those clinical trials across 47 states. The next slide it goes into the different approaches, and this is very important as we hear so much mRNA, messenger RNA. We know that this vaccine that was just approved and now distributed as of this week by Pfizer is an mRNA approach. We know that the one up on Thursday by Moderna and NIH is also an mRNA approach, a novel approach never been approved before. Vaccine. We know vaccines take about 7 years for approval. We know that they use different approaches. And again, never an mRNA has been approved, but it's very exciting because there were no cutting corners. We made sure that the safety standards, just because there was a pandemic and a real need to get something out there, no safety corners were cut. And the FDA, which is the premier safety and approval regulatory agency, I think, in the world, made sure that there was no cutting corners, no political pressures, no pressure from the communities to get something out quickly until those safety barriers and those the standards were met as they normally would be. And you'll see that there's a ton of different approaches. You see the inactivated flu vaccine where there's a weakened or a dead virus that we get every year to make sure that it protects us against what might be one of 3 strains that the CDC predicts encounter. The mRNA approach is different, and it actually mobilizes our immune system by leveraging our genetic code. And then we have the next 2 that are up that are going a J&J vaccine that we'll talk about in a moment that's going to be up soon in the next couple weeks for approval. And that uses a cold or an adenovirus. So multiple different ways to approach immunity for vaccines, but just wanted to show you that it's not a one size fits all, and it goes to really speaks volumes on the incredible work of our scientists, because as I mentioned earlier on, 7 years to come up with a vaccine, and we did it in less than 10 to 12 months. And it usually has a 95% failure. So to see that only 5% of vaccines in development ever make it, and we are now seeing what will be 2, hopefully by the end of this week, approved, and 4 by the end of next month. Wow. Next slide. This talks to you a little bit about the misconceptions. I cover state policy with my colleagues, as I mentioned, Linda and Peter, and we hear several states are introducing some scary pieces of legislation that are just plain misinformed about what is mRNA. Some legislative bills are saying that they're tampering with the genetic makeup, that it actually alters your genetic coding. So it's really important that we get the facts out. The mRNA never uses the live code virus, and it can't give you the virus. It does not interact or change the DNA in your virus. It never enters the nucleus. It requires less amount of the vaccine, which is good news for the manufacturing process. And we have held ourselves to the rigorous standards that we needed as in other vaccines. So just a quick little snapshot, but important because there's a lot of fear out there and we need to counter it with information. And the CDC, just before our webinar, and I'm going to send this to Maureen, but it has a quick, it's called question and answers, 2-pagers for healthcare providers about COVID vaccinations. Very simple, like what if I don't get my second dose? Which is now required for both of these first 2 vaccines. You have to get one on day 28 and one on day 21. What happens if you've already had COVID? Do you need that shot again? Do you need the shot? And the answer is yes, but the CDC addresses some of those questions that we all could actually take to our own families or small gatherings or Zooms within our family gatherings this holiday. It might be helpful. Next slide. So as we look at those exciting things, and again, Gina did a great job of showing what's coming up on the timeline. You see the BioNTech and Pfizer that just was approved, Moderna that is up for this Thursday, and then looking to the left, J&J and AZ, as I mentioned, using the cold virus is coming up in the next couple weeks because it's now concluding phase 3. So really good information, all of them requiring unique storage and distribution challenges. So as Gina had mentioned, -70 below Celsius is the BioNTech Pfizer refrigeration requirement. Why? Because it destabilizes and becomes ineffective if it becomes warmer. You need to keep it frozen or it won't be effective in our human bodies. So super important, but super concerning for the countries that don't have refrigerators or the dissemination in developing countries where they rarely have a working refrigerator, let alone a -70 below Celsius refrigerator, will be a challenge. So good that we have things like Johnson & Johnson that might be requiring regular temperature of a refrigerator or other options for because it's not just here in the US that's worried about this vaccine. Of course, we need to worry about getting this vaccine to everyone in the world. Huge challenge. Next slide. So we have, I think we went too fast. One back. Thank you, perfect. So the tools to accelerate the vaccine, I had told you, how in the world did we get this in 12 months or less? One of the ways that we are able to do that is not just because of the technology and the expertise to decode the virus in 4 months. That was helpful, but we were able to, for the first time ever, manufacture millions of doses before approval. So that meant Pfizer and some of these other companies that I just referenced have been and are making millions of doses that they risked needing to throw out if not approved by the FDA. But that puts you all the much sooner and ready when we do get that authorization that we can get it to the patients that need it. So that upscaling of manufacturing is something that was done this time that had never been done before and really helped us get ahead of the curve and will continue helping us get ahead of the curve because, as I said, other companies are doing that. Then once we have that emergency use authorization, which is unusual, it is not an approval, but it is an authorization by FDA because it says the risks outweigh the benefits of getting this unapproved treatment to the public because of the pandemic. And it doesn't require less safety standards, but it's a different way. It's not a normal approval. But it is a great way that not only has this vaccine been under EUA, but some of our treatments, because we would be remiss if we didn't talk about treatments, not just vaccines. that have had EUA, and we'll talk about that in a moment. But once that authorization has been approved, as we saw last week, ACIP, which is the an incredible guiding body that releases information on who should get that vaccine, how should it be covered, cost-wise, how should it be disseminated to which priority populations. They issue guidance within 24, 48 hours, and then the distribution goes forward. So you'll see that kind of schematic, which kind of helps you in your mind to figure out what all has to happen, what triggers have to be hit as we near that EUA or that authorization process. Next slide. So then we get into, after talking about this timeline, the next slide shows you, see, I think it went too fast. It's trigger happy. Sorry, one back. The blue one. Yes, one forward. Thank you, perfect. So these are the milestones that I just mentioned. The EUA, having the emergency authorization is incredible, and that is something new. But the state and local jurisdictions are going to be extremely creative. Minnesota is one of them, which is so interesting because each state had to put forth a plan to CDC saying this is how, once it's approved, we're going to get it out to our residents. So you can imagine public health, it's called PODS, point of dissemination, where states said we are going to get our vaccines out to the public using X, Y, and Z pods. Now a pod may be a car wash. It could be an open to air place where there's easy, people can funnel them through, you can get a vaccine and go. It could be a YMCA parking lot. It could be a mobile site set up. So very interesting, creative ways you're going to see each of the states try to get these mass vaccinations that we've never seen since polio set up so we can get people in and get them vaccinated quickly. But what's going to be very important, and Minnesota has a good plan on this, is the adherence. How do you get the patient to remember to come back on day 28 or day 21 if it's Moderna? Because you can't skip a dose. It's not going to have enough, you're not going to have enough immunity. There's not enough data to even say, can you or should you start over? And not to mention the demand is high, supplies are low. So we need to make sure that patient that gets it doesn't just get a reminder card, please come back in 28 days, but that they get a call, that they get reminded and they understand before they leave that facility and that healthcare provider that they have to, it is on them to get that second dose so that they can build their immunity. That first dose is stimulating their immune system, but it's the second dose that guarantees and builds enough immunity so that when or if they encounter the COVID virus, they can fight it. Next slide. So as we talk about the different steps, as we had already talked about ACIP, and the Department of Defense is incredible. They're working with the National Guard to get the distributions out to the pods, as we just talked about. But we, as manufacturers, continue our jobs well after manufacturing and approval. We continue to do safety monitoring for 24 months, up to 24 months or more after the vaccine is approved, because we want to make sure that it is safe. Next slide. And as I'm getting to the end, I just wanted to, we can actually skip that because we went through that. But next one is just the state challenges. We already kind of covered that, but looking at, do we have enough healthcare providers? It's really unique that eye doctors and dentists are asking to have their scope of practice amended so that they can give those vaccines. Veterinarians are asking to give vaccinations. Interesting to see all the different providers that when we have a shortage, how are we going to get people vaccinated quickly? So you'll see a lot of this in Minnesota if you haven't already. And then finally, the next slide talks to you a little bit about all the great vaccination efforts. I'll send you that CDC quick answers for healthcare professionals and patients to come in questions about COVID. But here are just a smattering of other groups that have really good information on vaccines, because we must make sure that, I saw an earlier question in the chat about herd immunity. We've got to make sure we have enough immunity in the community. And it's going to take years to make sure that we have sufficient vaccinations, and people that have been exposed to the virus naturally and those that have been vaccinated, it's going to, the estimates are 94% or higher to achieve herd immunity. So we have a long way to go. And then finally, next slide just tells you a little bit about our work on vaccine confidence, we've been giving our data to being super transparent. Whether it's too weedy or not, we figured it's better to just give the data so people understand where we're coming from. We've always shared data with the FDA, but this is where we have actually pledged to sharing our data with the public so that they understand that there are no cutting corners. And if they want to see the data, they are able to do that. Next slide. So as I mentioned, we'd be remiss if we didn't talk about treatments. There's an arsenal of things that our healthcare providers can use to treat a patient should they be exposed with mild or severe symptoms from COVID. And some of those different treatments, you know that there's Regeneron, there's Lilly, there's Gilead. Those are 3 of our member companies that make treatments, but they treat with antivirals. They treat, remdesivir, the arthritis drug that Lilly has had emergency use authorization to treat that will help greatly alleviate moderate COVID symptoms in adults and kids 12 years and older. So really good stuff happening in this area. They have monoclonal antibodies, which is a class of medications that's incredible that will also, they're man-made immune system proteins from a lab that help fight that virus directly. So just as we close down, where do you go for more information? The next and last slide just tells you a little bit about where you can go. And we have a lot of, one more, there you go. That's where we can give you a plethora of information. CDC has great information. We can make sure and all of us contribute to getting answers to your questions. But thank you for this time and allowing us to present.
Well, thank you so much, Sharon. I tell you, between the 3 of you, my mind is like, there was a lot there, but very, very helpful information and lots of great resources. I know the questions that have come through the chat have been answered, so thank you for monitoring that. I think it's also important to note, Dan Huff had one final comment. And his comment is this: the vaccine is a total game changer for the pandemic. However, we cannot let down our guard in protecting each other from COVID. We do not anticipate enough vaccine having been administered until spring. And so again, there is hope on the horizon. There's lots to be optimistic about, that we can gather together, but let's please, let's just be very careful as we get through, because I believe the next 2 months are going to be very critical months for us, and deaths, and we just want to get through this. So again, let's not rest on our laurels. Let's be vigilant. I'm not seeing my family for the holidays. It's a sacrifice, but for us to get through this, I'm willing to do anything. On behalf of the Dakota County Regional Chamber of Commerce, our members, our boards, I want to thank the panelists so much for coming. I also want to thank our sponsors as well. Sharon, if you get that handout to me, I'll get that out to all the people who attend, and then we'll put it in our weekly update. So Sharon, Gina, and Dan, thank you so much. Have a great day. There's one last question in the chat. So Dan or Gina, if you could take a peek at that before we shut it down, that would be awesome. Sharon, glad you didn't make jury duty so you could be here today. Sharon was on the fence, would she be here or not, but she had a backup. So thank you so much. Everyone have a safe and happy holiday, and we'll see you next year.
I think you got it, Dan. Yeah, thanks. Okay.